Hi, Dr. Saxena here, and been talking on some of the small nitty-gritties, what matters most, and I've been talking about something very good minerals which help you. Yes, I'm going to talk on something called magnesium today, and which is one of the basic. We feel this is one of the basic, fundamental, essential and mineral which is used for hundreds of biochemical reactions. I can always tell you more than 300 of biochemical reactions are managed by this magnesium. What happens is that we are talking about sudden magnesium deficiency. One of the major reasons which is not being picked up here is because the magnesium deficiency is misdiagnosed, but because it's not shown in the blood test. You check the serum magnesium levels, it should be normally, it will show more or less normal, but we are talking about the intracellular magnesium. Intracellular magnesium is often depleted and we don't know what is happening at that level. So needless to say, whatever we are talking about magnesium status, all there are some clinical parameters which we try to poke which are usually, I generally see a lot of magnesium deficiencies. People have increased sensitive to noise, that can be because of magnesium deficiencies. People are nervous, jittery, they are having some big stress and all that. They are depressed, they have confusion, twitchings and all that, and twitchings and blepharospasm. They will have some kind of apprehensions, insomnia. All these are things of signs of the mild deficiency of magnesium. Gets you into all of these things. And what is the thing which is making you this magnesium deficient is nothing but the modern diet and overabundance of refined grains and processed foods and sugars which contain very little of magnesium. Um, having said that, we have to agree here that the all the this particular thing has been declining. Magnesium content is declining in this very steadily because of there is a depletion of minerals in our soil. Making magnesium is a more supplement. That's the reason in my clinic I use everyone. I try to put them on transdermal or something like magnesium glycinate and all that, because I can always tell you every known illness is associated with the magnesium deficiency. Magnesium deficiency, quite big thing. You need to understand this particular thing because magnesium is the most critical mineral required for electrical stability of every cell in the body. See, to maintain this gradient, what is being shown here, with 16 millivolts and all that, you require that kind of magnesium. Otherwise, there is that transmembrane potential doesn't stay there. Usually, we keep seeing a lot of cases like simple depression will be easier. Low magnesium causes metabolic functions to decrease, and which causes further stress on the body, and this reducing the ability to retain the magnesium. Magnesium deficiency is usually responsible for more disease than any other nutrient which has been agreed upon. And upon this particular thing has to be taken into a big level. It can manifest as some kind of simple depression, or it can be manifesting as something like a cardiac arrest as well. See, we need to look at this particular thing, and I know this people are suffering endlessly, needlessly, because of their symptoms are treated by expensive drugs when they can be cured by simple magnesium supplementation. And I can always further tell you, magnesium is considered the anti-stress mineral. It's a natural tranquilizer that functions to relax skeletal muscles as well as smooth muscles of blood vessels and as well as of the GIT. Anything natural anti-stress is always we welcome. And two things which are always happening: your stress is not coming down, and because of nutrients, so many things. But magnesium is one thing which can help you in maintaining your muscles to relax, as well as to BP also to come. So this is one thing which is we have been talking about, and we had told about this particular thing, that magnesium, it's not detected on the blood screen tests and all that. We need to really go beyond that. Intracellular magnesium is not properly checked here, but somewhere what I believe is you need to work out more on a clinical part, because magnesium deficiency is a real entity, and this is one thing which has to be taken totally in a proper way, because transdermal magnesium and oral magnesium also, anything which goes into extra is being excreted, it's not really harmful. So we try to look into some of the things like what is the kind of this one, hydration and all that, and we somewhere believe this is for some reason, this is one of the essential. This is one of the essential for life. Is this magnesium, apart from the other things. I believe it is more important than potassium, sodium, and all. So for me, in my practice, I try to see that every one of us, every one of the patient, it can come. It from ranges from autism to cancer to allergies and all that. All of them are being told to take this transdermal magnesium. It's like even people who are into looking at something like trying to work on sports or something, they should always look into this thing called magnesium, and because this is one thing which is this will help in their athletic performance. And so what are the symptoms of this magnesium deficiency? Symptoms are usually most of the people has insomnia, some people have a headache, instability, anxieties, and memory is very common. They have some tremors also. This mental illness associated with increasing severe neuronal magnesium deficiency is a kind of thing, and usually people present with a lot of cluster headaches, apathy. You have people presenting in migraine have base underlying denominator is the low magnesium levels, and most of the presentations are just simple like that, something like leg cramps. And I can always tell about one of the patients we were treating, and all the time everything has been covered except for the magnesium. A person taking a vitamin E, every stuff to control their leg cramps, and you need to look at magnesium also. Other signs of early deficiency are usually can be loss of appetite, nausea, vomiting, and fever. The people get into, as the magnesium deficiency worsens, you get into something like numbness, tingling, seizures can happen, as well as abnormal heart rhythms, as well as some internal pains can happen. See, this is the severe disease which causes this numbness and tingling, as well as seizures also are described. With regard to the skeletal muscle, one may experience something like twitchings. I was talking about blepharospasm, cramps, muscle tension, muscle soreness, including backaches, including neck pain, tension headache, and TMG dysfunction. So these are a few of the things, and apart from that, you may have symptoms which include something like impairment of contraction of smooth muscles, such as constipation is a very common thing among the people who are deficient in magnesium. You have people who present with they tend to go to pee regularly because of their urinary spasms. The bladder becomes hyperactive. As soon as the bladder fills 40-50 ml also, he has the urge to pass urine. This is usually seen in geriatric age group people, and people with menstrual cramps. They present with people having a lot of this particular stuff. People have sensation of lump in the throat. I can remember one of the patient who had been through cardiac various checks and all that, and he always used to have that difficulty swallowing. It was not swallowing, but he used to feel that lump in the throat. and we just corrected by supplementing magnesium. It was so easy kind of stuff. And some things are it feels easy, but I can always tell you this particular thing which is very tough, in the sense, you if you are having a chest pain and you have some sensation that they can't take a deep breath, yeah, like frequent sigh, these people, they land into hospitals, and the main problem is the magnesium deficiency. Apart from that, you have got something like mental health kind of thing. CNS system is markedly affected. Symptoms like insomnia, high anxiety, hyperactivity, restlessness. So there are a host of all things. Panic attacks are very commonly seen in people who has got this magnesium deficiency. Magnesium symptoms involve, already told you about this particular thing. This is what looks like early warning signs of a chest pain. You feel the pressure in the chest, in the center, and you can have pain in the shoulders and neck and arms as well. And usually they may go into some kind of chest discomfort with faint sweating or nausea. So these are the things which are probably due to spasms in the coronary arteries, and if it is properly, this magnesium is they occur together. There are it may be a case of heart attack, but usually magnesium deficiency always has a predisposition for a heart attack. So a good idea is to keep your magnesium good at good levels, so that you won't get into that particular thing. And simple, we always see someone coming like this, and he is always upset, and he is always cranky, and I can always tell you, looking at him, I can say his magnesium is down. um, and other things are something like mental issues. Any anxiety and panic attacks are addressed by magnesium, by keeping adrenal stress hormones under control, so it really helps in dealing with stressful emergencies. This is one of the talks, and I can always tell you, there is something called salt craving, and as well as carbohydrate craving and carbohydrate intolerance, especially of chocolate and things. And this is purely a magnesium kind of stuff. To I think I still have a lot of things which I would like to share, but I can always. There is a host of this is one of the mineral which is needed by every cell in the body, including the brain, and the most important minerals. And it's one of the most important minerals when it comes to, when it is. Because it has vital role in more than 300 enzymatic reactions, and as well as essential for synthesis proteins and utilization of carbohydrates and the fats. This is one thing I can always tell you, this is needed in all my practice. For the last 15-20 years I'm using magnesium, because this is one thing which is needed for the production of specific detoxification enzymes. It's not just for detoxification, but also important for energy production related to cell detoxification. I can always tell you, magnesium deficiency can affect virtually every system of the body, be it lymphatics or the respiratory, digestive system, urinary system, or reproductive system. You need to, we try to go to this extent. Like water, we need magnesium every day, and there is an eternal need for magnesium as well as water. And when magnesium is present in water life, health is enhanced. So you understand what is this chlorophyll and magnesium has got that synergy. Uh, I somewhere try to look into most of the things, from a the perspective of deficiency of magnesium, because I can always tell you, just by supplementing that in a simple way, they get into so many good, they get so much benefit. A person who has got a diabetes, and if I put him on magnesium, and the way I try to do transdermally, it can always help in insulin resistance and coping up with this insulin resistance. This is a big issue when we are dealing with diabetic patients as well as obesity. So we need to work out that for that insulin resistance, and magnesium helps fabulously. And these are the symptoms. There are a lot of things which are linked with magnesium. It can be early signs of magnesium deficiency. I have been talking about this, and you need to understand this. The people will present with physical and mental fatigue, persistent under eye twitch, tension in upper back or shoulders and neck, as well as headache. Females may have premenstrual fluid retention or breast tenderness. So what are the manifestations of this magnesium deficiency? Manifestations are usually low energy. They have fatigue in common, weakness, confusion. You have got nervousness. You have got anxiety, irritability. It can go up to seizures, and again, poor digestion, inability to sleep. All these things are quite common. And calcification of the organs. I have been more talking about calcification, which happens in pineal gland, calcification which happens in vascular calcification. All these are the result of magnesium deficiency. We fail to understand why this so simple thing, which is deficiency. There is always a homeostasis between calcium and magnesium, and if this homeostasis is not maintained, calcium goes for called dystrophic calcification. This is quite a big thing when we started looking at that, because we were not ready. Um, uh, so uh, this is we were not in the sense we couldn't diagnose, because we used to depend on that stupid serum test, and it doesn't show anything. So sometimes a severe magnesium deficiency can result in low levels of blood calcium as well. So it can have hypocalcemia. They may be associated with something like hypokalemia. They may be associated with kind of disturbance in the sleep and all that, which we have already discussed. And usually the presentations are like mouth ulcers, blood vision, fatigue, anxiety, and these are the things which are very common with this particular stuff. So this is one of the things which we have been already trying to work it out, and I somehow had a privilege of working on this particular stuff, and we tried working on some of the simple things, and we believe that this is one of the diabetes have the I've been always talking magnesium deficiency is diabetes. Many people have diabetes for about 5 years before they show strong symptoms. And for me, whatever diabetes, this is because of insulin resistance, and it is because of the magnesium deficiency. This is the basic kind of thing which we have been talking about. So. So we always I always look into what is the other things which diabetes has something. We believe in mercury, arsenic causing diabetes, but at the same time, all these things deplete the body magnesium and causes things. And I am into a this one. I can always tell you about this particular study, where what shown was magnesium deficiency is a predictor of diabetes and heart disease both. Diabetics both need more magnesium and lose more magnesium than most people. This is one of the big things which has been shown. So I normally we have very few largest studies have directly examined the long-term effects of dietary magnesium on diabetes, but I see there is a lot of kind of crossovers here, and this is diabetes and magnesium deficiency are probably one and the same. I go further. We can always look into what is causing this disharmony, about what is this excessive urination is bodies. See, the thirst of diabetes is because of body's response to excessive urination. And the excessive urination is the body's attempt to get rid of extra glucose in the body, in the blood. So we need to look at what is causing these levels of disharmony. And the body needs to disperse glucose because of increasing insulin resistance, and that resistance is fueled by directly by magnesium deficiency, which makes toxic insults more damaging to the tissues at the same time. So this is what we are trying to work it out. And apart from that, when the body, when the magnesium, this glucose, diabetics get too high blood sugar, the body creates ketones, a breakdown product which can lead to something like diabetic ketoacidosis. This is a very dangerous condition because it can lead into diabetic coma as well. So when we talk about this one, this particular thing, when magnesium supplements are added here, they reduce erythrocyte dehydration, and which helps in maintaining the possible hydration. So it is diabetic thirst for me. It's one thing which you need to always understand. That it is initiated by magnesium deficiency. It is you feel thirsty because you are depleted of the minerals. You need minerals. You need not just need only water. This is one thing which has to be properly understood. And see, water has got we have, this is one of the basic things, and this is why I certainly believe magnesium as the most important mineral. And I would like to work it out. Having worked in something called autism, and where I picked up what is this magnesium up to, and I started using this magnesium into not just autism kids or hyperactive kids and all that, where I got tremendous response by just doing transdermal magnesium. But I started slowly for diabetics, heart disease patients. Now I'm proud to have some patients who are having a kind of not even fit for surgery. There's a kind of cases which has got something like ischemic cardiomyopathy, and they are being told to manage with medications. And we start doing this kind of stuff, and we work on my magnesium and other stuff. And I certainly can tell you, this is nothing can beat this particular thing. No wonder drug that can claim in the clear what magnesium chloride can do. And for me, magnesium is one of the best things which has I stumbled upon, and for the last 20 years I have been regularly giving it to my patients. And it is one of simple things which I would like to, because you don't need a kind of we used to talk about Epsom salt baths and all that before. Now we create a transdermal thing and give it. And I can tell you, one of the best things what I had uh, done so far, taking the patient to the next level, in the sense they are doing fabulously fine. I'm talking about ischemic cardiomyopathy, diabetic foods. I'm talking about people having severe kind of problems. They are stabilized by this particular stuff, and they shower blessings on me. Thank you.